Hello, my name is Ollie, Dr Ollie Hart. I've been a GP for 25 years and I'm one of the founding directors of Peak Health Coaching. I've always been super interested in how health coaching fits into the health and social care services, and increasingly how workplaces are joining in as well to contribute to health creating landscapes. This 13-minute video updates you on where we see the greatest impact of health coaching and similar person-centred roles. In considering the landscape of health coaching, we have to start with Dolger and Whitehead's classic diagram, don't we? A little controversial when it first came out, nearly 40 years ago, but now widely accepted as a key descriptor of the range of factors that influence our health. It's helpful to consider where health coaching can play a role, with its focus on helping people to understand what's most relevant to them in their physical and social context. So at the centre, whilst there are some things you can't change about who you are, understanding your current health status, things like your blood pressure, sugar levels and BMI, might help you make good decisions. Health coaches can help raise awareness about lifestyle factors you can influence, like the food you eat, how you move or manage stress and sleep. Similarly, as we move out to social factors, how connected you are and the supportive networks you inhabit, and your living and work conditions, you can think about the significant influence they have on your opportunity to have or live a healthy life that matches your values and aspirations. All the time, good health coaches keep a focus on what's within your locus of control, drawing people's attention to the things they have power to influence and change and accepting those they don't. And of course, wider socioeconomic, cultural and environmental factors may be out of your control, but important to hold a shared understanding of how they might restrict and influence people's thoughts, options and actions. So with this in mind, we consider three domains that we think really impact health and well-being, where we can have some effect and some interventions. So there's the health considerations, and traditionally this falls in the realm of the traditional health services, so general practice, hospital specialist care, some of the community support increasingly, that cover the sort of health factors. Then there's the social considerations, perhaps falling into the realms of formal social care, but delivered by also voluntary sector and community groups, where you get support for housing, for your finances, how you navigate the benefit system, how you navigate your community setting. And of course, then there's the domain of self-care, how you look after yourself, be that as an individual or within the community that you exist. And we're driving for people to be proactive, to be resilient and have energy and capability, what some people term activation. So we're looking for people activation. So when we consider these three domains, what we particularly recognise is that this shared space between the health and social considerations is really crucial. And it's so important that it's coordinated and joined up. And there are shared values across the health approach and the social support. But perhaps even more important that both of these are orientated around improving the agency and capability of people at growing the self-care function as far as possible. Obviously, it'll be tuned into people's capabilities and the assets they've got available to them. And this is where I think a coaching approach really comes in. So within this context, we're seeing an evolution of the caring landscape. We're seeing professionals shifting from being fixers in a traditional model to being enablers and facilitators. We're seeing the patients being asked to move from being a passive recipient role to being active partners in their care. We're seeing the system move from being reactive to being proactive and preventative. And we're seeing the overall approach moving on from a deficit illness model to a proactive asset-based or health-creating approach. And we're seeing the enablers of IT and digital, absolutely really important, but also this coaching mindset, this enabling growth mindset wrapped around with really good quality improvement as well. And of course, this matches the NHS articulated shifts from the latest government, where they've articulated three key shifts from hospital to community, from reactive to preventative NHS care, and from analogue to digital. And we're also real fans of Professor Sir Chris Ham, who talked about a fourth shift as well, moving away from providers to agency resting with patients, people and populations. So there's a real synergy between this kind of shift and transition of how the landscape is moving. So this emphasises that health is created in different settings, isn't it? Perhaps in the middle there's the person, the heart of the Dahlgren-Whitehead diagram, people making decisions for themselves in their everyday context, in their everyday situation. But they're also then thinking about the decisions that are influenced by their work and their social context, or their formal interactions with health and social care providers. And I think we need to be mindful of how health coaching, both the mindset and the practice, can come into all these three areas. So let's focus on the NHS context to start off with, the traditional health setting. And generally there's two types of disease models at work here. There's what we call the acute disease model. This is for immediate emergency style injuries or damage, so injury or trauma, accidents, acute infection, sudden onset, new diagnosis of cancer or inflammation or a mental health crisis. And in these short-term immediate situations, the proportion of value delivered by each of these three circles probably looks a little bit like this, where actually you want healthcare to be predominating. Perhaps there's a part to play what you do for yourself or your social setting, but it's definitely dwarfed by the rapid onset of the health interventions that we all want. We want quick diagnosis, we want advice and treatment, and we want the system to mobilise resources to rescue us and treat us quickly. Let's contrast that to the chronic disease model, again well described in the literature. The sort of diseases that we're seeing now more and more common, so those long-term things like metabolic dysfunction, so type 2 diabetes, non-alcoholic fatty liver disease, the vascular diseases, strokes and heart attacks, the respiratory conditions like chronic lung disease, asthma, chronic pain, a really big one now, the biggest long-term condition that we experience, and chronic mental health. And in this situation, in contrast to the acute, the value of the bubbles changes. And whilst healthcare is important, actually the prominence of social and self-care become much more significant. And in terms of self-care, we want people to have skills, knowledge, confidence, motivation to get involved. And in terms of the social setting, we want to pay attention to their housing, their work, their social connections, finances, access to facilities, and that formal social care. And actually, this is now around 50 to 70% of all NHS activity. It's in the context of supporting this chronic model, which is becoming the majority of the NHS care, that we see these new roles emerging. We see health coaching and health and wellbeing coaching sitting at the interface between health and self-care, translating some of those health details and information, but helping people to build their self-management skills. We see social prescribed link workers at the interface between social input and, again, self-care, helping people to become as autonomous and self-helping as possible within their social context, making the most of the assets that are in their communities. And this role of care coordination that perhaps sits at the heart of it for people with the most complicated life circumstances, where there's a need to coordinate what's going on in their health sector with what's happening socially, and also hopefully building their self-care skills. And I think this is also perhaps where we're seeing workplace health and wellbeing coaching sit, with people who are in the workplace where they're again trying to navigate managing health conditions or preventing health conditions with the social context of their workplace, at the same time trying to build their personal autonomy. And what we're hoping with this focus on building people's self-management capability is that patients become a resource to themselves, but they also become a resource to others as well, where they feed back into the system. And we can take the value from peer support, both in a social setting and in a health setting, where we learn from people who have already trodden the path and managed to navigate things successfully and feed their learning back into the system. So we've seen this understanding develop into specific roles, what are sometimes termed the personalised care roles, expanding the NHS workforce to deliver this integrated, particularly chronic disease focused support. We've seen an expansion of health and wellbeing coaches, social prescribing link workers and care coordinators as recognised and employed roles in the NHS, predominantly in primary care, but also increasingly seen in specialist hospital settings as well. And we're thinking about how they interact with the rest of the clinical care team, and how we create multidisciplinary teams that expand the scope of what we can do. And how's this playing out in the workplace? Well, we're seeing an expansion of health coaching support, either externally provided through schemes like the Work Well scheme, or internally organisations training up health coaches within the workforce to offer support to each other and bring these health coaching skills into the everyday DNA of how workplaces operate. They're interacting with traditional occupational health and employee support schemes where they might be thinking about workplace adaptations, but also, again, trying to adopt this growth mindset and this positive approach, health coaching approach. And of course, we're learning how that interacts with the traditional sort of HR teams and line managers as well. So as we grapple with how we can support this evolving landscape, what we try to do at Peak Health Coaching is to tailor our approach to the different roles and the level of time and the level of training that people need. So we have a full ramp of health coaching, but the first 2 days is a foundation course aimed at building those skills into everyone's roles, be they nurses, doctors, therapists in the NHS, or whether they're in the workplace, perhaps the HR teams or line managers, or even just peers supporting each other. This provides the basic foundation for health coaching skills for all. You can then extend that on to 4 days by adding 2 days on top if you're going to perhaps have a more dedicated health and wellbeing coaching role. In the NHS, of course, that is for health and wellbeing coaches. And we hope perhaps social prescribing link workers and care coordinators may see the value of either a 2 or extending to a 4-day training, depending on the depth of their health coaching delivery. And of course, also in workplaces, we're seeing the value of training internal and external provision of health coaches to support the crucial setting of the workplace. We've learnt over the last few years that whilst training people in 4 days is great and gets people up to a level where they can really implement different ways of working, supervision and support is crucial, particularly as they'll often be having quite harrowing conversations with people who are dealing with a lot of trauma or past problems. And supervision for the coach to improve the quality of what they do, but also to help them manage, is crucial. Where will it lead to? Well, what we really hope is that we can realise our full potential to fully embed health coaching into the NHS, health and social care settings and workplaces. So we have an extension of the 4-day training which takes people into practitioner 1 and 2, where we will assess their progress, we will support them gaining experience through their health coaching practice and deepen their skills. And this extends up to a full 600-hour diploma, which is approved by the UK International Health Coaching Association, and enables people to join at what is internationally recognised as a fully fledged health coaching level. We're also hoping that the whole system will engage. There's what we call a what matters to you mindset, where everybody from the front door, from receptionists, admin, secretarial, right to the most senior members of the team are cognizant of this coaching style approach, and where we're focused on what matters to the person, making it person-centered and personalised, rather than just trying to make them fit into the big system. And of course, within this as well, we are looking to build this concept of peer support, be that patients to patients or be that workplace champions, people who understand what it's like to try and navigate and maintain good health in their workplace setting. So thanks for listening all the way through. I hope this gives you an idea of where we think the current landscape sits, the opportunities and the potential for taking this forward and growing this into a really highly effective way of creating systems that create health and keep us healthy, a genuine shift from reactive care to preventative care.